Hello, my name is Sven Putnis. I'm a consultant knee specialist surgeon based in Bristol. Today I'm going to talk about meniscal tears. The meniscus is a flexible fibre cartilage that's positioned in both the inside and the outside of the knee joint, a very important structure to guide function and also to protect the cartilage coating of the knee. Meniscal tears can occur at all different stages in life through lots of different mechanisms. Sporting injuries are common where the meniscus is traumatically torn. This can cause the meniscus to lock inside the knee, and often urgent surgery is required for that. The meniscus is pushed back into the joint with keyhole surgery, and then it's repaired in that position. Once the meniscus heals, it can allow a return to full sporting function. The meniscus can also degenerate through your life. It can lose some of its blood supply or water content. The meniscus has blood supply from the edge, but also gets a lot of its nutrition from the synovial fluid. And the synovial fluid is something which is being researched to try and work out why that can change in its function. If a meniscus tears throughout life, a degenerative tear, it can cause a lot of pain and a lot of dysfunction. It's very important to get an early diagnosis with an MRI scan, as the meniscus can tear in different positions, in different types, and we need to identify the meniscus tear early. Some meniscus tears can cause complete dysfunction of the meniscus, and if this isn't repaired back, then it puts a lot of pressure on the cartilage of the knee, and this in turn can lead to osteoarthritis. Once you've had the MRI scan, it's important to come and see a specialist like myself to talk through the images. I can talk you through the MRI scan and explain the anatomy to you, and then give you options. There might be meniscal tears that settle down in time with teamwork, physiotherapy, strengthening and conditioning to get you through that. Sometimes injections can help with the pain. But as mentioned, there are meniscal tears which would benefit from surgery. The majority are fixed, are repaired through an arthroscopic approach, keyhole approach to the knee. And I'm lucky to have access to a number of different devices to ensure the meniscus is repaired. Blood can be taken or bone marrow can be taken to aid that repair process and allow you to get back to full function. So it's important to get the MRI scan to identify the tear. It's really important to have the different options, both non-operative and operative. And then if operative options are chosen, to discuss your recovery and how we're going to get you back to that full level of function, doing all the activities that you want to do in life and getting back to sport and protecting the knee from future degeneration and potential osteoarthritis.